Tennessee has been particularly hard hit by the prescription opioid epidemic. It has one of the highest rates of opioid overdose deaths. And Eastern Tennessee in particular has been hard hit. So I came here today to meet with community members, including elected officials, doctors and nurses, community advocates, to learn more about how the community is combating the epidemic here. Well, I think that there's a lot of good things that are happening here in Tennessee. There's a lot that the state is doing right. I spoke earlier today with community members about the use of PDMPs, which are prescription drug monitoring programs, which are being used now to improve the way that doctors prescribe medicines to treat pain. I also learned more today and over the last few days about naloxone access. And naloxone is an important medicine for reversing opioid overdoses. It's a medicine that's been made more and more available here in the state of Tennessee. And the community is coming together to also educate each other and to make sure the prescribers in particular are educated. So there's a lot that's happening that's right, but there's a lot more that we have to do because we know that both in Tennessee and also around the country, there are far more people who need treatment than are actually getting it. We know in the United States at large, for example, that there are about 2.2 million people who need treatment for opioid addiction, but only about 1 million who are getting it. And we have to close that gap. If we look at the prescription opioid problem overall, we see that there are a few key steps that we have to take. One is that we have to work with doctors and nurse practitioners and dentists to change prescribing practices so that we are treating pain safely but effectively. We also have to ensure that more people have access to treatment that's affordable. We have to, third, ensure that naloxone, which can be a life-saving medicine, is available and in the hands of first responders, patients, and their family members. And fourth, we have to educate the community so that people know that opioids are addictive, but that there are also things that you can do to keep yourself and your family safe, like disposing of opioids after you've used them, and making sure that if you do have a prescription, that your medicines are kept locked away so that other people can't access them. But I'll say that there's a fifth and very important thing that we have to do, perhaps something that's even more difficult than all the rest. And that's that we have to change how our country thinks about addiction. For far too many people who are living with addiction, they feel that there are negative attitudes and stigma which make it hard for them to come forward and get help. We also find that there are communities which wouldn't mind if there was a new center for heart disease or for cancer built in their neighborhood, but which don't want treatment centers for addiction in their neighborhoods because they worry it'll bring bad people to their community. But the truth is that addiction is a chronic illness like diabetes, heart disease, or any other condition. Addiction is not a moral failing or a character flaw. And so we have to shift how we think about addiction because until we do that, it's going to be hard for us to ultimately get treatment to people who need it.